I was born in India, grew up in India, did my medical school in India, and then was lucky enough to get into one of the most prestigious orthopedic residencies in India. Our school was built in 1878, so quite a long ways. A tough program. I worked with some very great surgeons, then decided to pursue further education. I had family in Canada, so Canada was a natural destination. And I went through the residency program called the Practice Ready Assessment and became board certified by the Royal College of Surgeons of Canada. Then moved to the US, practiced in Minnesota, and was looking for a warmer weather and decided Louisiana was the place for us. I've always been attracted to orthopedics for a couple of reasons. Right throughout schooling, my father had two really good friends who were both orthopedic surgeons. So we would often get the opportunity to visit their clinic and see what they did. So I did have some exposure even in school. Going through medical school, that exposure increased. I did break a knuckle playing cricket, so I had to go to an orthopedic surgeon, again my father's friend, and that just really piqued my interest in orthopedics, where we were able to deal with a lot of sporting injuries, a lot of broken bones, and having my grandmother undergo 2 knee replacements, I was very actively involved in that. I saw what a difference it makes, especially in an elderly person's life. When patients come to us with pain, there is some degree of expectation that we will solve their problem. It's that hope which makes us get out of bed and go to work. I'm lucky that I got trained to be an orthopedic surgeon. The best part about that is we see tangible results where we are able to fix a problem. Somebody who comes in pain and now they're able to go back to play with their grandkids. They're able to go back to sporting activities. That's just huge for us. So that's something which motivates me every single day. Any new patient who reaches out to our practice, we make the utmost effort to be able to see them right away, which can be sometimes as soon as even 24 hours or the same day. We understand that patients are in pain and they're looking for help. We also are very conscious about the previous investigations that they've already undergone, and we try not to repeat them if not needed. We make sure that we try and maximize non-surgical treatment before we jump onto any surgical options. I do some amount of general practice. My focus, however, remains joint replacement and joint preservation. That allows me to work with younger athletes and help them in preserving their joints and their cartilage. Then it also allows me to look after the seniors and offer them joint replacement surgery. I do a lot of trauma surgery or fracture surgery as well, being fellowship trained in both joints and trauma surgery. My treatment philosophy for every single patient is I view them as a family member. I would do the exact same thing what I would do for my own family. I would treat them non-surgically or surgically depending on their situation. We always like to try simple measures first and see if they are able to help the patient. It's a series of steps. As you go through them, you realize maybe surgery is the only option, but that's not something we rush into. We treat them with our dignity and a team approach. The patient is involved in the decision-making process at all steps. What I saw at Willis Knighton was amazing. The commitment to patient care, the degree of independence that physicians enjoyed in developing their own practice, and the support from management. I could feel that connection right away when I met the rest of the staff, the administration, my other physician colleagues. The energy, the welcoming nature was very appealing to both me and my wife.